In 2022, Captain Ibrahim Traoré seized power in Burkina Faso, promising to prioritize security and improve the lives of ordinary citizens. While it's still early days, Traoré's government has made some encouraging noises about healthcare reform. His administration has pledged to increase healthcare spending, recruit more healthcare workers, and improve access to healthcare in rural areas. Time will tell whether these promises translate into concrete action, but the initial signs are cautiously optimistic. Recognizing the dire state of Burkina Faso's healthcare system, the World Bank has stepped in with a $167 million funding package aimed at strengthening the country's health infrastructure and improving access to essential health services. This funding, approved in January 2025, will support a range of initiatives including disease surveillance, improved nutrition programs for women and children, and enhanced healthcare services for internally displaced people and underserved communities. Childbirth can be a perilous journey for women in Burkina Faso. The maternal mortality rate remains alarmingly high, a grim testament to the lack of access to quality maternal health care. Many women give birth at home without the assistance of skilled birth attendants, increasing the risk of complications. Even when healthcare facilities are available, distance, cost, and a lack of awareness about the importance of prenatal care often prevent women from seeking timely medical attention. Amidst these challenges, initiatives like the REACH program offer a beacon of hope. REACH, a collaborative effort involving the International Federation of Red Cross and Red Crescent Societies, the Africa Centers for Disease Control and Prevention, and the Burkina Faso Red Cross, is working tirelessly to improve healthcare access and delivery across Africa, including Burkina Faso. REACH focuses on strengthening national health systems, supporting vaccination campaigns, improving disease surveillance, and bolstering community-based health interventions. The Red Cross, a lifeline in times of crisis. The Burkina Faso Red Cross, with support from its international partners, has been instrumental in providing critical healthcare services, especially in conflict-affected and remote areas. In a country where access to medical facilities is often limited, the Red Cross has stepped in to fill the gap, ensuring that even the most isolated communities receive the care they need. Their efforts have not only provided immediate relief, but have also helped to build a more resilient healthcare system for the future. Their volunteers brave insecurity and logistical challenges to reach the most vulnerable communities. Whether it's crossing difficult terrain or navigating through conflict zones, these dedicated individuals go above and beyond to deliver essential services. Their commitment is a testament to the Red Cross's mission of alleviating human suffering and protecting life and health. One notable success was the Red Cross's response to the 2024 dengue fever outbreak. This crisis tested their capacity to respond quickly and effectively. The outbreak posed a significant threat to public health, but the Red Cross's swift action helped to mitigate its impact. Their coordinated efforts ensured that resources were mobilized efficiently, and that those affected received timely medical attention. Through a combination of mosquito control measures, disinfection campaigns, and community awareness programs, the Red Cross effectively contained the outbreak, reaching over 123,000 people with life-saving interventions. These initiatives not only addressed the immediate crisis but also educated communities on how to prevent future outbreaks. The Red Cross's holistic approach, which includes both emergency response and long-term prevention strategies, has made a lasting impact on public health in Burkina Faso. Their work continues to inspire and demonstrate the power of collective action in times of crisis. Community engagement, the key to sustainable change. Top-down approaches to healthcare reform are often met with resistance and fail to address the unique needs of local communities. Recognizing this, organizations like the REACH Initiative and the Red Cross have made community engagement a cornerstone of their healthcare interventions. By training and empowering community health workers, these organizations are bridging the gap between healthcare providers and remote communities. These local heroes understand the cultural sensitivities, language barriers, and logistical challenges that often hinder healthcare access. On the path to progress. While there are glimmers of hope, Burkina Faso's journey towards a more robust healthcare system is fraught with challenges. Deep-seated poverty, ongoing insecurity, political instability, and a shortage of trained healthcare professionals continue to hamper progress. Corruption also casts a long shadow, diverting precious resources away from essential healthcare services. Building a more equitable and effective healthcare system will require sustained commitment, increased investment, and a relentless focus on good governance. Traore's health policy and context. While Traore's health policies build on the foundations laid by previous administrations, they also signal a potential shift in approach. There's a greater emphasis on self-reliance, with the government seeking to reduce dependence on foreign aid and mobilize domestic resources for health. This includes exploring innovative financing mechanisms, such as community-based health insurance schemes, and strengthening tax collection to increase government revenue. Traore has also shown a willingness to diversify Burkina Faso's international partnerships. While maintaining ties with traditional partners like France, he has sought closer collaboration with countries like Russia and China, particularly in areas like military cooperation and infrastructure development. Whether this shift in foreign policy will translate into tangible benefits for Burkina Faso's health sector remains to be seen. Care on the move reaching the unreachable. In a country where vast distances, poor infrastructure, and insecurity often hinder access to healthcare, mobile clinics have emerged as a vital lifeline. These mobile medical units, often mounted on trucks or motorcycles, bring essential healthcare services directly to remote communities and those displaced by conflict. They are equipped to provide a range of services, from basic medical consultations and vaccinations to prenatal care and emergency treatment. The Burkinabe government, in collaboration with international organizations like the WHO and UNICEF, operates a fleet of mobile clinics. Non-governmental organizations, or NGOs, like Doctors Without Borders, also known as MSF, play a crucial role in providing mobile healthcare services, particularly in conflict zones. Mobile clinics are not without their limitations. They often face logistical challenges, security risks, and funding constraints. However, their ability to reach the most vulnerable and underserved populations makes them an indispensable part of Burkina Faso's healthcare system. Burkina Faso's hospitals, the cornerstones of its healthcare system, face immense pressure. The country has a limited number of hospitals, unevenly distributed across its territory, with a clear disparity between urban and rural areas. Most specialized medical services are concentrated in the capital, Ouagadougou, and a few other major cities, leaving those in rural areas with limited access to advanced care. Many hospitals operate with a severe shortage of essential medical equipment, medicines, and qualified staff. The doctor-to-patient ratio remains alarmingly low, particularly in specialized fields. The ongoing conflict has exacerbated these challenges, with attacks on hospitals disrupting service delivery and forcing some facilities to close. Despite these challenges, dedicated healthcare professionals in Burkina Faso's hospitals work tirelessly to provide the best possible care with the limited resources available. Only time will tell if Ibrahim Traore's government can deliver on its promises.